Hello, this is Dr. Kavya Krishnappa, fertility consultant, GarbhaGudi IVF Center, Jayanagar. Today I'll be talking about role of ERA in repeated implantation failure. So what is repeated implantation failure? In spite of doing more than 2 or 3 embryo transfer with good quality embryos, we have gotten a negative result is known as repeated implantation failure. The causes of repeated implantation failure might be many. One of them is the embryo quality, the endometrium lining, how is the uterus, any other medical conditions, genetic conditions. So the commonest one what we are talking about today, I'll be concentrating on the endometrium. So how good the endometrium lining was and when we have transferred. Supposedly we have transferred a day 5 embryo and still we have gotten a negative result, a very good blast, and still gotten a negative result. So we can do a testing called as ERA, Endometrial Receptivity Assay. So the same way how we prepare an endometrium, we start off with HRT, that is we start with estrogen and then give progesterone. And on the day 5, we take a small sample of the endometrium and then send it for testing. After testing, they will tell us whether we have done the transfer at the receptive time. That is, the endometrium is ready to receive the embryo or pre-receptive. That is, the endometrium is still not ready to receive the endometrium, or post-receptive. We have gone beyond the time of receptive. That is, window of implantation. The endometrium, when it is ready to receive the embryo, we term it as window of implantation. So, whether we have to delay our time of embryo transfer or we have to do an early embryo transfer will depend on this ERA testing. After doing the ERA test, we set the treatment for a personalized embryo transfer. So having done this, many of our patients have conceived and got their pregnancy positive.